following program contains the opinions of its host and guests, not those of this network. The opinions expressed are for non-commercial informational purposes only. Listeners are cautioned not to rely on program content to treat or prevent disease, but are advised to consult with a licensed healthcare professional where they live for diagnosis and treatment of disease.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free, 1-888-379-2552. And that's toll-free, 1-888-379-2552. Well, we need to talk about the diseases we're number one in the world for, okay? Obesity, diabetes, high blood pressure, cardiovascular disease, kidney failure, and dialysis. They're all kind of related. And so I was blessed when I was doing my residency. I actually bought a clinic, hired two doctors to run it while I did my residency in my own clinic. It was a bariatric clinic. It was a clinic that dealt with obesity and high blood pressure, diabetes, kidney failure, all the things that have to do with vascular disease, plugged arteries and so forth. So I really, over the 2 years I did my residency and the 12 years I ran the clinic before I sold it, 14 years dealing with these kind of diseases. And so built systems to prevent and reverse them, okay? Obesity is not due to too much food and lack of exercise. This is due to deficiency of any one of the members of a certain class of nutrients. Diabetes, type 2 diabetes is 98% of the diabetic population. It's a simple nutritional deficiency. Type 1 diabetes is a birth defect of the islets of Langerhans and the beta cells that make insulin. Easily prevented. You have to give insulin for these kids that have type 1 diabetes. We can actually lower the requirement by maybe 90% and cut the number of times they need to check their blood sugar from 6 times a day to 2 times a day or 1 time a day. High blood pressure can be due to multiple nutritional deficiencies. It can also be due to plugged arteries, and particularly in the kidney, and the kidney will release a hormone called renin to elevate the blood pressure, drive more dirty blood into the kidney. Cardiovascular disease issues, congestive heart failure is due to a deficiency of a single vitamin. Sudden heart deaths from cardiomyopathy heart disease is due to a deficiency of a single mineral. Ruptured aneurysms due to a deficiency of a different mineral. And, of course, when you have things like coronary artery disease or vascular dementia or kidney artery disease, has nothing to do with cholesterol. In fact, it's due to inflammation. I ran into the first actual coronary artery disease naturally occurring in wild animals is 2 wild sheep from the Atlas Mountains of North Africa, just north of Morocco. They'd only been in captivity for 2 months. They died three days apart. Did the autopsies, and they died from massive coronary artery disease, 98% blockage, the worst case of coronary artery disease ever seen in sheep, recently caught in Africa up in the mountains. Where are they getting the cholesterol? I mean, they're eating grasses and wild grains and twigs and things, and yet they had the most horrible case of plugged arteries I've ever seen. And then, of course, there's thrombosis, blood clots. Coronary thrombosis, a blood clot in the coronary arteries due to a deficiency of a single nutrient. The same thing with a stroke, where you get a blood clot in a blood vessel in the brain is due to the same deficiency. You get a pulmonary embolism, you get a blood clot in the lung is due to the deficiency of the same nutrient. Deep vein thrombosis in your legs due to a deficiency, the same deficiency. So all this is due to deficiency. Some of them, again, like vascular dementia and coronary artery disease, is due to inflammation and the deficiency, right? And so we got to work at this. Now, I want you to get off all the bad foods, the fried foods, processed meats, oils, and glutens. Get rid of the inflammation. This is forever, for life, not for just a couple of weeks. Then, of course, once you get a hold of the book, Dead Doctors Don't Lie, the CD, the DVD that goes along with it, Dead Doctors Don't Lie. And let's see, an update on this Dead Doctors Don't Lie is a stick of butter a day keeps the doctor away. A stick of butter a day keeps the doctor away. Very appropriate for this subject. And then Hell's Kitchen. There's a book, and there's a CD that goes along with it by the same title. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And then, of course, Energy Crisis goes into the diets, the keto diet. Of course, we have a longevity, the keto caramel shakes, the keto caramel meal bars. For 3 or 4 days out of the week, you can do all 3 meals, one of those keto caramel meals. Okay, I wouldn't do both of those. You're defeating the purpose. But you can choose the bar or the shake, okay? And that's all. How this works is in the book Energy Crisis. And let's see here. Then, of course, Rare Herbs and Cures really goes into the mineral deficiencies that result in obesity, diabetes, high blood pressure, cardiovascular disease, kidney failure, and so on. And, of course, we have a program called the Healthy Brain and Heart Pack. You throw in some secret sauces like the Sweeties, Ultimate Daily Classic Tablets, and let's see what else here, more minerals. And all of these are designed to support the body's needs for these nutrients to prevent these diseases. If you have these diseases, given the supplements, your body has the capacity to heal itself. Your body has the capacity to heal itself. When the sperm fertilizes the egg, you're XX female, XY male. Your hair color, eye color, and skin color are all predetermined at that point. But for the rest of your life, the job of the genes, DNA, RNA, and telomeres is to repair and maintain every cell in your body. I mean, we're talking about every tissue, every organ, every system goes away. And if you don't have the nutrients, the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids, you get a disease. And if you're really seriously missing one or more of those, you die. And so why not do preventive medicine and take these things before you get sick? Then you won't get sick. Wow, what a concept. We'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us between noon and 1 Pacific at 831-685-1080, toll free 888-379-2552. Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWork disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to do the longevity business as a business, I urge you to contact your longevity associate and ask for that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy, and learn how to deal with over 900 different diseases. 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. The trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, Passport Aromatherapy. Learn how to do a physical examination yourself, the equivalent of one that a doctor would do and charge your insurance company $2,000. You can do the same exact physical for $4.50, getting the test strips from the pharmacy without a prescription for blood and urine, the equivalent of a colonoscopic exam. And then this information you get doesn't go on your insurance records. You do not have, quote, a pre-existing condition, unquote. And so what you find out does not impact your insurance monthly premiums nor your deductible. And, of course, you take the appropriate nutritional program. What would you use the weight loss program for? What would you use the healthy weight loss pack? What would you use the healthy blood sugar pack for? What would you use the healthy brain and heart pack for? And the healthy sports pack and healthy anti-aging pack and so on. And just follow these simple guidelines, and you can save literally millions of dollars and add 25 to 50 healthy years to your life. Okay, Doug, what pearls of wisdom do you have for us?
Well, this goes along with what you were talking about in your monologue, as I've got a story here that came from CBS News headline, study, almost half of diabetics skip medical care due to costs. They say this new survey as coming out as a skyrocketing price of insulin is prompting lawmakers and physicians to call for more oversight. The AMA, American Medical Association, has called for federal intervention to protect diabetics from being exploited by price gouging of insulin products. They want the Federal Trade Commission and the Justice Department to track this insulin pricing market competition and protect consumers. And according to AMA board member William A. McDade, he said it is shocking and unconscionable that patients are struggling to get basic medicine like insulin. Insulin is one of the most essential drugs across all categories of pharmaceuticals to show substantial increase in price. Average price of insulin has nearly tripled between 2002 and 2013, according to the American Diabetes Association. They say nearly 1 in 10 Americans, or roughly 30 million, are using insulin, and the cost for two manufacturers rose nearly 8% just last year. There's no generic version of this drug that's been around almost 100 years, and the main three manufacturers, Eli Lilly, Sanofi, and Novo Nordisk, control 99% of the market, so there is really no market competition there. And an online poll conducted in 2017 found that 45% of diabetics reported that sometimes they go without care because they can't afford it. More than 4 out of 10 diabetics, they say they spent more than $1,000 in out-of-pocket costs in the past year for diabetes complications. Another one-third spent between $100 and $500, the survey found. One father told a Senate committee that his 13-year-old son's insulin had jumped from $300 for a 90-day supply in 2017 to more than $900. And they say that they can buy insulin in Canada for about $300. So this is obviously, these companies are, just gouging Americans.
Yeah, and of course, again, this is more reason to do these things yourself. And type 2 diabetes, that makes up 90% of the diabetic population, very easy to get rid of. You supplement properly, you change your diet, and your body heals itself. Type 1 diabetes, we can certainly manage a lot better than they do with simple nutrients. And the nice thing about this is, Doug, the individual will pay the same amount, the same wholesale price that doctors pay for our products, and we'll show them how to get them for free. If they don't want to get them for free, then you pay the wholesale price. We'll pay the shipping if they get on auto ship. It saves us a lot of book work, and so it just goes out every month, and they can add to or subtract from without any penalties. And we pay the shipping if they get on auto ship, so they actually save another 8 to 10%, depending on where they live. It's an amazing thing, and this was the whole purpose of leveraging my time, putting together the Longevity Company with these prepackaged programs for 900 different diseases. And that way, everybody is able to deal with these health problems themselves, just like AutoZone and Pep Boys, just like Lowe's and Home Depot, huh? Let's do it ourselves, save ourselves all this unnecessary expense. It's safer and much more efficient. Huh. Well, thank you for bringing that one up, Doug, and we'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call the priority line 831-685-1080, toll free 888-379-2552. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the healthy benefits of drinking coffee. Youngevity has now taken it a step further with an entire product line of healthy coffees from Youngevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium, hand-selected Arabica coffee beans grown in the finest regions of Latin America. All are carefully roasted, creating a delicious, rich, full-bodied flavor. For an extra boost, try JavaFit's Energy Extreme 62, a proprietary blend of nutrients including Cambogia, green tea extract, an extra shot of caffeine, and niacin. Designed to support metabolism and enhance physical performance. Available in single cup or single pot packs. Contact your local Youngevity distributor to get Jovolution coffees. And don't forget to ask about the home-based business opportunity.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for the books Hell's Kitchen and the CD that goes along with it by the same title, Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. It also discusses type 2 diabetes and the metabolic syndrome. And, of course, the reason why we're the number one obese nation in the world is because medical doctors and the government has followed the theory, 125-year-old theory, perfectly. And they believe falsely that obesity and being overweight is due to eating too much and lack of exercise. Nope. Being overweight and obese is due to the deficiency of any one of the members of a certain class of nutrients, and there's 3 of those nutrients. If you're deficient in any one of those, 3 of them, okay, you will be the 300-pound, 500-pound, 800-pound person. Then, of course, you need to get a hold of, in addition to Hell's Kitchen, the book and the CD, you need to get a hold of the book Energy Crisis, and they go into the keto caramel diet, and which helps you lose a half a pound to 2 pounds a day with the Healthy Weight Loss Pack, 1 per 100 pounds of body weight. And you won't gain the weight back as long as you stay on your 90 essential nutrients. Remember, being overweight and obese is not due to eating too much and lack of exercise. It is due to a nutritional deficiency. Okay, Doug, let's go to callers.
All right, let's head to Cleveland, Ohio. And Joe, you're on with Dr. Wallach.
Joe, you're on the air.
Hello.
Yes, sir.
I've been taking the Healthy Bone and Joint Pack to treat osteoporosis and TMJ for the better part of a year, and it's working. The tenderness and swelling is gone. My hearing started coming back. However, I have 2 symptoms that remain unchanged. I was wondering if I should change my treatment at all. The first one is if I relax the muscles in my neck and head, my head sits crooked on my neck. So it'd be like the top of it would point at 11 o'clock instead of 12 o'clock.
Okay.
And the second is my jaw clicks and crunches every time I swallow.
Okay, so the head sort of twisted or off to one side can be called torticollis, okay? And you could have some arthritis in the TMJ joint, and you may have TMJ arthritis, okay? What do you weigh, sir?
165.
Okay, any other issues, any high blood pressure, diabetes?
No.
Okay, good. Charmaine, you there?
I'm here.
Okay, dear. He's taken the Healthy Bone and Joint Pack and having some pretty good results for his osteoarthritis and those kind of issues, but he still has some neck issues, maybe some disc in his neck, cartilage, tendons, ligaments, and he also has some TMJ, it sounds like, temporal mandibular joint thing, which is very common, osteoporosis of the skull. So what would you add to his program to give him a more complete program? There's a couple of things he's missing. What is he missing?
Well, I would, for those issues, I would add some MSM and some vitamin D3.
Well, dear, you get an A++, perfect. Okay, so that's what you need to add to your program, Joe. At your body weight, 165 pounds, you want to take 3 of the vitamin D3 capsules twice a day, 3 at breakfast, 3 at dinner time. You want to take, I'd go ahead with 3 of those MSM tablets 3 times a day. It'll be 2 bottles a month. And just add that to your program. Make sure you're taking 1 of the Healthy Bone and Joint Packs per 100 pounds of body weight, 15 glucogel capsules a day. And use the CM cream on those joints, your TMJ joints. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. That does open a line if you'd like to talk to Dr. Wallach today. Call us on the toll-free line, 888-379-2552. Lines open. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.
This is the ZBS Radio Network.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Give us a call, toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200 plus, while being biologically 30, 40, 50, contact your Longevity associate and ask for the books, the Epigenetics, The Death of the Genetic Theory of Disease Transmission, and, of course, the DVD called Praise the Lord and Pass the 90, a takeoff on the First World War soldiers' prayer when they were charging German machine guns. Praise the Lord and Pass the ammunition, okay? And then you want to get a hold of the book Immortality, okay, and the CD that goes along with the same title. Actually, it's a DVD. Immortality, it's a CD. Immortality, Forever Young. Immortality for Forever Young. And learn why the top 20 longevity cultures have 40 times 100-year-olds we do. They have 100-year-old per 250 of their population. We Americans have only 1 per 10,000. We spend more money for health care than all the nations of the world put together. We spend more money every year than 207 nations for health care. We only rank 43rd when it comes to longevity and health. Okay, and then, of course, you want the book Rare Earths and Cures, and look at all these cultures that are, in fact, doing the job, living longer than us. 19 of the top 20 cultures are third world cultures. They have no amenities. They have nothing. Yet they outlive us by 40 times. Okay, Doug, let's go to callers.
Let's head to Cedar Springs, Michigan. And Thomas, you're on with Dr. Wallach.
Oh, Thomas, you're on the air.
Thank you. I have a heart valve that's leaking. I've had 4 ablations, and I am currently in sinus rhythm. I have ED and a bladder that's overactive, and then my left ankle is swollen with varicose veins from a knee operation.
Okay, were you diagnosed with atrial fibrillation?
Yes.
Okay. Yeah, okay. That's usually why they give ablation, trying to kill your heart muscle, to try and find the spot that's running amok and giving you the fast heart rate and the palpitations and everything. What do you weigh, sir?
I weigh 180 pounds.
Okay, how tall are you?
6 foot, 6'1".
Okay. Any other issues? Diabetes, high blood pressure, arthritis?
No.
Okay.
Blood pressure.
Otherwise, I'm sorry?
The blood pressure is very good.
Okay, so otherwise, other than this vascular stuff, everything from varicose veins to heart valve regurgitation, ablation for AFib, and that kind of stuff, you do have some ED and some overactive bladder, right?
Yeah, it gets incontinence at point, just severe urges to.
Yeah. Okay, do you have a low back problem?
Low back? Just, I would say minor, if anything.
Well, okay, you don't have to have a lot of pain to have a low back problem, because what's happening with that overactive bladder and the low back problem, Charmaine?
Well, it even goes into the AFib. It's all basically mechanical, and it's osteoporosis.
Yeah, okay, osteoporosis and also degenerative disc disease. Have you shrunk any since you were 20 years old?
Yeah, probably an inch.
Okay, well, there you go. You have degenerative disc disease. That means that the vertebrae are getting closer together, and as Shar said, smashing the roots of the spinal nerves that control your bladder, that control your heart rhythm and rate, okay? And, of course, the doctors are just doing mechanical things to stop your heart from going fast and palpitating. So what would you do for this guy, Charmaine, to support healthy maintenance repair of his cardiovascular system, his kidneys, his bladder? Hang on, we got to run to one of those message moments. But we will be back, and so get your pen and paper ready, Thomas, because Charmaine is going to offer something that's going to really help support a better life for you. We'll be back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network. If you'd like to talk to Dr. Wallach, we do have some open lines. Call us on the toll-free line, 888-379-2552, on the priority line, 831-685-1080. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. And that's toll-free, 1-888-379-2552. And if you're going to do the Youngevity business as a business, I urge you to contact your Youngevity associates and the numbers you hear on this station. and get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. The trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, Passport Aromatherapy. If you have no experience in running a business, either your own or somebody else's, get a hold of the book, Wall Street for Kids, and learn how to create an income stream and be profitable. I mean, that's the whole point of this thing, right? And then also, you're going to learn how to get the tax breaks of billionaires. We don't want to take away the tax breaks of billionaires. We want to get them, but the only way you can get the tax breaks of billionaires is to what? Oh, gosh, you want to have your own business. Right now is a good time because your first $24,000 of your income is tax-free. So all you have to do is have the tax breaks for the other $25,000 of your income, and it's tax-free if you run your business correctly. Wall Street for Kids will teach you how to do it. Okay, Doug, let's go right back to Michigan and Thomas. Okay, what are you going to do for this guy, Charmaine, dietary-wise first? Let's look at his diet. What's a good diet for his issues and problems?
Well, he should get on a gluten-free diet, no fried foods for sure, and no burnt animal fat, no oils of any kind. And for his issues, I would get him on 2 healthy bone and joint packs, Zeratest, Ultimate Daily Classic, vitamin D3, and MSM. Okay,
well, yeah, you hit it all right on the message. And you said MSM and glucogel, right? Because glucogel comes with the healthy bone and joint packs.
Right.
I'd throw some selenium in also, since you picked that route.
Okay.
I'd throw in some selenium, 2 bottles of selenium. He could take 3 of those twice a day. 2 healthy bone and joint packs per month, full dose of everything twice a day. That's 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, to support and promote maintenance, repair, cartilage, ligaments, tendons, disc between the vertebrae. Why are we worried about disc between the vertebrae, Charmaine?
Because that's what's causing the AFib.
And the bladder problem, where he has incontinence. He just walks along peeing in his pants, right?
Right.
Okay.
Yep.
And then, you got to give him the raw materials to rebuild those discs, push the vertebrae apart. Okay. And let's see here. And also, and you said the Ultimate Daily Classic tablets, right?
Yep.
For the heart valve issues and that kind of stuff, which may or may not be true, but let's give them the healthy or the Ultimate Daily Classic tablets. So 3 of those twice a day, 2 bottles a month. They're designed to support and promote healthy blood pressure, but also healthy blood flow through the coronary arteries and the brain arteries and the kidney arteries. Very important here. And then give us a call every 2 weeks in Michigan. It's going to take you 3 to 5 days to get the product. Start your diet immediately. As Char said, get rid of the bad stuff, fried foods, processed meats, oils, and glutens. And then as soon as 2 weeks after you start your supplement program, call us in 2 weeks and 4 weeks and 6 weeks and 8 weeks. We'll walk you through this, Thomas. We deal with this literally thousands of times a month around the world. People respond exactly correctly because guess what? The body wants to heal itself. It just requires these nutrients. Okay, Doug, let's go to callers.
All right, let's head to Mesa, Arizona. And Patricia, you're on with Dr. Wallach.
Hello, Patricia. You're on the air.
Wallach.
Hi. How can we help you?
Hello?
Yes, how can we help you?
Yes, my mom is 78 years old, and she has been on statin drugs for several years, and she's showing signs of dementia.
Okay, what does she weigh?
She weighs 108 pounds.
108, small lady, okay. And does she have any other issues, high blood pressure, diabetes, arthritis?
Yeah, high blood pressure. That's why they had her on the statin drugs, which don't work. I know. Mm-hmm. And in the past, she had cataracts and kidney stones, and she does have hay fever, allergies.
Okay, kidney stones, allergies. Does she have any skin problems or anything like that?
No, her skin looks great, actually.
Okay. What about her bowels? Any constipation, diarrhea, belly pain, that kind of stuff? Crohn's disease?
I know every once in a while she mentions she has diarrhea, but not very often.
Okay. Well, it's kind of like being pregnant. Okay, either you is or you ain't.
Right.
Okay, Charmaine, this gal's about your size. Her mom is 108 pounds, about your size. And so what diet would you put her on to begin with to, and of course, do you want her to stay on the statins or get off?
Oh, no, we took her off of them, me and my
sister. You did already, okay. So what kind of diet would you put her on to support healthy memory?
Well, she needs to be on a high good fat diet like eggs and butter.
Mm-hmm.
And
Yeah, so she could listen to and Patricia, you need to listen to that CD. A stick of butter a day keeps the doctor away. That's all the issue. And at 108 pounds, I'd have her take 3 eggs twice a day. They can be poached soft yolks, soft-boiled soft yolks, soft scrambled butter, no oils, no margarine, no over easy, no fried eggs, okay? And then what supplement program would you give her, Charmaine?
Well, for her issues, I think I would get her on a healthy brain and heart pack, and then I would add the Ultimate Daily Classic, and she should be good to go, and maybe some vitamin D3.
Okay, yeah, her age, vitamin D3, and what else would you throw in for?
Well, she has
kidney stones, which means she has osteoporosis.
Yes, well, the Healthy Brain and Heart Pack has stuff in there, but she could take some extra.
How about some MSM?
MSM, yeah, and glucogel for that matter too.
And glucogel, yep. And so at her body weight, how many glucogel do you take? You weigh about 110 pounds.
Well, I try to take 12 a day.
Okay, so 12 a day of the glucogel capsules, and you take 6 and 6 because I know you take it twice a day.
Yep.
And then what about the MSM?
The MSM I just take 2 twice a day, so I take 4 a day of those. Okay,
so she could take 2 or 3 twice a day because she has kidney stones, that kind of stuff. And let's see here. Okay, so what would you do in addition to the eggs? What would you do? What would you throw in for that to support really better memory and brain function? In addition to the eggs,
I would suggest she takes the Synaptive.
Synaptive, very good. Synaptive, SYN, okay, APTIV, kind of like synapses. It's the raw materials for the brain to make neurotransmitters so the brain cells can talk to each other. But people recover very quickly and get their memory back and so forth. Taking away the bad stuff, okay, which is the statin drugs, because cholesterol is your best friend. Remember, your brain is 75% white matter, and that white matter of your brain is almost 100% cholesterol. As it goes away, remember we talked earlier in the show, as your all tissues, as it goes away, if you're not replacing it, you get diseases. And so you must replace that cholesterol that you're losing every day from your myelin, the white matter in the brain, and other tissues in the body, hormones, and thing in the lady be ovaries, men will be testicles, and so on. And so it's imperative to replace everything you're losing, and that way your body can maintain itself. It requires raw materials to do that stuff. So call us if you would every couple of weeks, Patricia. It'll take about 2 to 3 days to get the products into Arizona, but you can start your mom's diet adjustments today, and then call us every 2 weeks, and we'll walk you through this. Okay, Doug, we got time to start another one?
Yeah, let's get one started. Let's head to Washington State. And Cooper, you're on with Dr. Wallach.
Cooper, you're on the air.
Hi, Dr. Wallach.
Yes, sir.
I had a question about my dog. He seems to be having a problem.
You're going in and out, so make sure you're facing the phone all the time.
Okay. Can you hear me now?
Yes, much better.
Okay, I'm having a problem with my dog. It seems to have a problem breathing through his nose. Is there anything you have to do with that?
Okay, how old's the dog?
I think he's about 8 or 9. I'm not sure. He's rescue.
Okay, now, does he have any skin problems and hot spots, or does he itch or scratch?
Yeah, he's got some lumps on him and things like that. I have him on the T for cancer.
Okay, so what you do is hang on, and Char and I will be back. We'll give you an answer to your questions right after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Youngevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals. as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Youngevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hello, Judy DeVilbus here. If I could only afford to get one product out of everything, that product would be the Ultimate Classic. It has the vitamins, the minerals, the bioflavonoids. It even has grapeseed extract. The one product that would give you just about everything under the sun you would need for a perfect nutritional program would be the Ultimate Classic. By the way, people that are on the go, it's very, very hard to take the liquids with them when they go on their trip to get their supplements in every day. Well, you know something? You can use the Ultimate Daily tablets and the mineral capsules. When I'm going on a trip, if I have enough room, I just take the 2 bottles with me. If not, just use a little baggie and take a couple of daily doses with you. It's very simple. It's very easy. There's no mess, no fuss, no refrigeration. Just take your capsules, take your tablets, and you're finished for the day.
To order these products, call your local Youngevity distributor today. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 95 Crusade. And Doug, let's go right back to Washington State and Cooper. One last question, Cooper, before we give you what we think are the answers here. Are you feeding your dog dry dog food or canned dog food?
Both.
Okay. Well, make sure that the dry dog food is grain-free and gluten-free. Grain-free and gluten-free, because they may have a gluten problem here. And so, Charmaine, in addition to the moist, you should only be eating moist dog food, kind of canned dog food as opposed to the dry. You've really got to watch the possibility of having gluten in there. What supplement program would you give Cooper's dog?
Well, for him, I would suggest that he take the Arthrodex, of course, based 21 scoop for 25 pounds of body weight per day. And then I would give him some EFAs every day. And if he can't eat them, if he's not big enough to eat them, I got a needle right on my windowsill, and I squeeze them into the food. I prick them and squeeze them into the food. And
okay, so how much does your dog weigh?
One of my dogs weighs, okay.
How much does your dog weigh,
33 pounds.
Yeah, so Char's exactly right. I'd go ahead and give your dog one of the EFAs and one of the EFA pluses. The EFA pluses are fish oils, and the EFAs are flaxseed oil and borage oil. Again, usually these dogs chomp that stuff down, but if they don't, just go ahead and take a needle and stick that those soft gel capsules and squirt the liquid on the food. But get rid of the dry dog food. Even if they say grain-free, gluten-free, you have to call the 800 number and see if they're processed on equipment or packaged on equipment that also packages wheat and grain products for pets because of cross-contamination. And so let's go that direction because that's a really good. The lungs produce a hormone which dilates the bronchi and makes them breathe easier. And the raw materials to make that happen are the EFAs. Okay, Doug, we have time to start another one?
Yeah, I think we do. Let's head to Woodland, California, and Carlos, you're on with Dr. Wallach.
Okay, Carlos, we only have a few moments here, so let's get to it. How can we help you, sir?
Yes, real quick. My wife has a swollen foot. She took a trip, a car trip to Arizona, from California to Arizona, came back, and her foot was swollen. She is on some of our the longevity projects. And by the way, I want to give a testimony real quick.
Okay.
I also got on it. Longevity, lost 45 pounds, and I thank God for you, Dr. Wallach. Thank you for changing my life.
Okay, thank you. Okay, so it's only one foot that's swollen. Is it the foot that she used on the gas and the brake, or is it the other foot?
She was a passenger. It's her left foot, and she was a passenger. And we're just like, wow, what happened?
Okay, here we go. Does she have any history of respiratory problems, asthma, bronchitis?
She had thyroid issues, and she was having a hard time breathing months back, you know. And
Okay, we got to go on here.
Yeah.
Does she have any skin issues, any eczema, dermatitis, or psoriasis?
No.
Do you have any children with those problems?
No, we don't.
Okay. Does your wife have any bowel problems, constipation, diarrhea?
Diarrhea, and she went gluten-free, like, for the last couple of months.
Okay.
But that's kind of been an issue with her off and on.
Okay, are you gluten-free?
Yes.
Okay. Well, she's got to work on that. I mean, it's got to be drop-dead gluten-free. And what does she weigh?
170.
170. Okay, Charmaine, what would you do for her to help her with that foot?
Well,
Got it. Moments. Got to go, girl.
Well, I guess I would get her on 2 healthy brain and heart packs, and I would add some glucogel and MSM for those issues.
And what else from the sun?
Vitamin D3.
Vitamin D3. There you go, Carlos. Get going on those things and call us in 2 weeks and 4 weeks and 6 weeks. We'll walk you guys through this. But thank you for the great testimony. And Charmaine, thank you so much for your super job. How much time we have here, Doug?
You got about 30 seconds.
30 seconds. Okay, well, I'm going to remind everybody, we're looking for help. We're growing quickly. We need more help to help all these people around the United States so they're not spending all this money for these expensive drugs when they can help their body heal itself. So contact your Youngevity associate and say, I'm in. What do I have to do? I want to be able to get my products for free, as well as help myself and my family with our health issues, but I do want to help other people. Okay, contact your Youngevity associate and let's go to work together. Okay, well, thank you, everybody. Great testimonies today. Thank you so much, Charmaine. Super job as usual. Thank you, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. God bless our American flag. God bless the national anthem. And God bless America.